and implementation of AB12-212 since January of this year. So I'm really happy to be on the webinar today to share with you some of the products and deliverables I think that will be helpful for you in going further.
So as it says in our agenda, we're going to start with the Supervisor Implementation Guide, and Sylvia is going to walk us through this document. I'm just going to pull it up via the CalSWEC website, and then once I get it on the screen, Sylvia, you just let me know. Actually, let me back up a little bit and say, and the implementation guide for supervisors is part of the implementation materials that we have. And as you go through the implementation guide for supervisors, we're going to reference the AB12 overview, which is also posted just above. But let's start with the guide. And here it is. Sylvia, you should be able to see that on your screen.
Yes, I do.
Okay.
All right, so let's go ahead and go to page 3, which really is just a summary of the implementation guide. I think a couple things I want to say before we really get into this material is that this material is repetitive in that it talks about what the eligibility criteria are in terms of how youth are eligible for the program and the types of placements. This guide was developed to really help supervisors be able to walk their staff through this change. And so it's a way of giving a supervisor like a mini training session that they could use in a unit meeting with their staff. So it's very flexible, it's very user-friendly, and you can pull what you need from it. You could break it into sessions if you needed to, or you could do it all at one time. But it does review the material more than once. It also is, I think, important that you, if you are a supervisor or you are in charge of other staff who are going to be working with the youth, it's important that you review these materials ahead of time and familiarize yourself with the materials, especially with the eligibility stuff. We don't know all the answers yet, and I want to say that out front. We are still waiting on some of the all-county letters to be developed, and so some of you may not even have your own local policy completely developed yet in your county. And we anticipate that all counties will develop local policy, but many of them are waiting on all county letters to be developed from the state to really provide that guidance. So back to what Melissa said earlier, we don't know all of the answers. We're going to give you as much as we can right now. The specifics around funding eligibility are going to be in a later training, and those trainings are being developed, and they are very extensive. So if you don't get all your answers today, please be assured that there is a number of different curriculums being developed to help you. So the beginning of the implementation guide really talks about the history of AB12 and how it came into being, and that really was the Federal Fostering Connections to Success Act. And in California, AB12 Assembly Bill 12 and then Assembly Bill 212 were the legislation pieces that really set into motion the development of extension of foster care for youth in California. So there's a lot of background information in this curriculum that really is for you to understand as a supervisor in trying to teach your staff, and certainly for any staff who are on the line, just some of the data around youth who exit foster care and some of the statistics around what their success or lack of success has been since they've been exiting at the age of 18. And I think what's important to remember is that many people know that not all youth are ready to leave the home at 18. In fact, most youth are not. And so in a nutshell, Fostering Connections to Success was really built around making sure that foster youth have the same opportunities as other youth during those young adult developmental stages, and have a safety net to provide them as they transition into adulthood. If we can turn to page 5, Melissa. So on page 5, you'll see that January 26, 2011 started the kickoff of our AB12 with many, many stakeholders. The legislation came into being certainly early on, with 212 early this year being approved. But I think what's important is that it is a there were many, many stakeholders involved in bringing this legislation to being, getting these changes to happen, and certainly in the development of all the policies and training and resources that are out there for youth. Many people are involved, including the courts, including stakeholders who provide services to youth, John Burton Foundation, agencies that provide transitional housing like AspiraNet, Olive Crest, a lot of involvement from our partners, the Youth Law Center, the Children's Law Center of Los Angeles, the Union, the Alliance for Children's Rights, California Youth Connections been very involved, so the Department of Social Services in the county. So it's been a joint effort to try and put this together. The values and principles of AB12 really are important, and what we want to make sure is that we don't lose the value of permanency for all kids, so all youth. So whether youth continue to choose to move to guardianship or adoption, or we continue to look for lifelong connections for youth, permanency is always key for what we are doing. And permanency should be a lifelong connection to a family type environment for a young person, so that they have somebody and somebody who can help them through the challenges they go through in life, and someplace they can go when they need to go there. So I think that that's what we want to keep in mind when we talk about AB12. We also want to, it's a little bit of a paradigm shift for us in child welfare, because we're looking at working much more collaboratively with the youth and engaging the youth in decision making about their own life. And so as social workers, those youth that do choose to continue on in foster care past the age of 18, their role, our role with them, our role as social workers with them is going to change significantly, in that we're no longer going to be telling them they can or they can't. You can't stay out late, you can't bring these friends over your house, you can't, we're no longer going to do that kind of stuff, because once they're 18 they are adults and they can live their life as adults. We can talk to them, provide guidance to them about what are good decisions and what, how to make better decisions about their choices in life, but not necessarily stop them from making choices and decisions. So we really want to work with the youth together to develop their lifelong connections, their independent living goals, and really help them to have real life experiences that we've all had as we transitioned into adulthood, but at the same time having that safety net available to them, so that they're not out on the streets homeless, they're not, engaging in criminal activity in order to survive, those kind of things. So those are the values that we want to maintain. I think we're going to go ahead and go to page 7. if you look at page 7, there are a number of resources for you to use when doing this training for staff or when trying to learn about AB12. These are all the all-county letters that are already available on the different programs that the Department of Social Services has already released. There's a bunch of reading material under the helpful reading that you can go to. These are all websites that you can go to. And then there's additional curriculum that is available on the CalSWEC website as well. So you can peruse all that information. There is an optional video from Place to Place, it's called. But Melissa, I don't know if you can let them know where they can access that, because I don't have that information.
Yeah, there's a link here in the guide to a website where you can purchase the movie, and there's a couple of different versions. Lisa might know a little bit more than I do about this one. There's a full-length movie, and then there's a 20-minute movie. You can also contact me about it, because at one point we were told that if multiple people across California wanted to purchase the movie in bulk, that they would give us a reduced rate. So I guess I should say that would be the first place to inquire about it, and I'll see if I can put together people who are interested. So I'll be sending that email out with all the materials at the end of today, and I'll include that in that email as well.
And I think that the benefit of the video, especially the short 17-minute video, is that it really traces the life of youth that have exited foster care and how they were crucial for the passing of the Federal Fostering Connections to Success Act. So I think it's really helpful when you are presenting this to staff or doing trainings that we recognize that this federal act really came from grassroots, came from the youth that were really advocating strongly for themselves. So I think it's a great video to show.
And somebody has put in a question or comment really letting it, so I'll say it's $41 total for both videos, the short and long version, just for everybody's information.
Okay. So this supervisor's guide is available on the website, as you saw Melissa go through, and you can, there's a lot of text there in those first couple of pages that you can read yourself. I'm not going to read all of those because I'm going to focus more on how you would walk your unit through this stuff. So we have on the screen a sample implementation plan, which is basically a plan for you to help your unit understand AB12 and 212. So you would want to, of course, read all the material ahead of time and have yourself as familiar as you can with this information prior to presenting it to your unit. There are suggestions for, in terms of having the unit meeting, that on the several pages that follow, page 10 and 11, and they finish on page 12, are different icebreakers that you could have to introduce your staff to this topic. So some of them are having a discussion about, with your staff about, okay, if you could choose a different path in your life, think about being 17 and getting ready to graduate from school. If you had the opportunity to choose a different path in life, what would you have done? And see where that discussion goes. There is an activity in which you have, there are cards that are definition cards. It's like a, I can't think of the word I wanted to use, but there's, at the back of this training material, there are definition cards or
like flashcards.
Flashcards.
Matching,
I'm sorry.
matching, yeah.
Flashcards. Yeah, that you can use, so you could cut them out and you could pair up your staff in small groups and have them try to match the definition to what subject that covers. So just different ways of engaging your staff in a discussion around trying to provide services to youth beyond the age of 18 and how that will be different. I think in any training that you're doing with staff or any learning opportunity, you want to remember the transfer of learning concept, and that is talking about it with staff before and then doing some kind of follow-up. So whether it's in unit meeting or in individual conferences with your staff, you'd always want to follow up in terms of some of the learning opportunities that you've presented to them, some of the material we're going to cover, to be able to get them to apply it, because if they don't apply it, then we're not going to be able to help the youth, and that's going to be important. That's going to be the important role of the supervisor, making sure that these youth are going to be treated differently as they're beginning to transition out of the system, or transition into adulthood, not necessarily out of the system. So we'll move forward from, so you see there's do the icebreakers, then we do the overview of the training. If you are in the middle of having that discussion, and we're going to go through the training materials, but always a good idea is to have a piece of paper or a flip chart paper that is called the parking lot for all the questions that you will get, because you're not going to have all the answers to the questions. They may come later. You may have to go somewhere else to get them, and come back to your staff with them. So always write down those questions so that you can follow up with them. And then additionally, the document provides a tracking sheet that you can use with your staff in engaging them in this training and discussion around looking at their particular caseload, writing down the names of the youth that they know are going to turn 18 over this next year, 2012, what date they're going to turn 18, and what their plans are, and just a way for you or each of the workers to track individually their youth who are aging out or aging on. I got to stop using aging out. Okay, there is a PowerPoint that accompanies these training materials as well, and that is available as well on the CalSWEC website. So if we can go to page 15. We'll talk about, these are, what you're seeing on the screen now are all the little icebreakers that you can do with your staff just to get them warmed up to the idea.
And I'm sorry if the scrolling is a little dizzying. That's just what it takes today.
Yeah.
Here's page 15.
Okay. So this is a training activity that you can do with the staff. Once again, you will see that some of the information in this particular section has already been covered earlier. So you don't have to reiterate all of this stuff, but you can if you want to. 2010, 4,800 youth aged out of foster care in California, and many of them are not equipped to handle that transition. How AB12 came into existence. It was legislation sponsored by Karen Bass and Assemblyman Jim Beal, and it actually goes into effect January 1st of 2012. The kin gap changes started in January of 2011, and we'll cover those. Once again, there's a listing of and a PowerPoint slide that shows all the agencies that were involved in the development of this. That's at the bottom of page 15. So there are all the agencies that were involved. So the PowerPoint slides 5 through 7 actually get into the eligibility issues. And so here's where you would want to just kind of walk them through the different eligibility issues. It does extend foster care until age 21, and we'll talk about the specifics of that, beginning with those who are age 18 and January 1st of 2012. It does provide the federal kin gap benefit to relative guardians. So the difference in KINGAP now is that now it is a federal program versus just a state-only program. So California had a KINGAP program for a number of years to pay relatives the difference between CalWORKs and foster care, and now the federal government has done that. So the federal government will now pay 50% share of the cost for those federally eligible youth. Not all of the youth will be federally eligible. It depends on what their initial eligibility was when they came into the system in the first place. So if they were not federally eligible, then they would be eligible for CalWORKs KINGAP. Now you also can exit KINGAP. The youth can exit KINGAP after only 6 months in placement versus it used to be 12 months in placement. And the amount of the KINGAP benefit is determined through a negotiated agreement based on the needs of the child. So it's no longer just a set amount. It's a negotiated rate similar to our adoption assistance rate, and it can be updated at least every 2 years. So if someone exited in KINGAP and the needs of that youth change, it can be renegotiated. They may enter KINGAP after 6 months in a voluntary placement agreement with an approved relative, or juvenile court orders guardianship without taking dependency. So if they go into a voluntary placement, some counties do voluntary placements. They can go into a KINGAP from a voluntary placement.
Sorry about that. I don't know why the page changed all of a sudden, so I'm just getting it back to where it was. My apologies.
Okay.
So let's just
hold
on for 1 second. I'm really sorry.
That's okay. I'll just keep talking. KINGAP is available to families now who move out of state, and it also is available for youth who have physical or mental disabilities up until age 21. So KINGAP and AAP assistance to eligible youth up to age 21 is provided as long as they entered KINGAP for adoption status after the age of 16, at 16 or later. Now, what's important to remember about AB12 is that the youth have to opt out. They're automatically in extended foster care unless they opt out. So it's important for you as social workers and as social work supervisors and probation officers and probation supervisors to make sure that you're asking the question of the youth what their plans are once they turn 18. And because they really are automatically in extended foster care unless they choose to opt out, and they can choose to opt out. Effective January 1st, 2012, youth are allowed to remain into foster care up to age 19. January 1st, 2013, the option is extended to youth who are up to age 20. And then January 1st, 2014, it will be up to age 21 if the legislature approves the funding. So at this point, it goes up to age 20 in 2013. And if the legislature approves funding, 2014 will include age 21. Now, there are a lot of questions about youth who are 18 now, or they turned 18 in September, and next September they're going to turn 19. Their eligibility expires when they turn 19 next year. But then they would be eligible again in 2013. So there would be a period of time, because they were 19 during 2012, when they would not be eligible, although the dependency could continue during that time and most likely would. So those are just gaps that we'll have to deal with. Now, for our references, these foster youth are now going to be known as non-minor dependents, and that's how they will be referred to in court, non-minor dependents. And then it talks about how they will meet the eligibility. So at the very bottom of page 16, and it moves on to the following page, is how they actually qualify for eligibility into extended foster care. So the old rule of will they finish high school by the time they turn 19, that old eligibility rule goes away for kids in extended foster care unless their guardianship went through probate court, and then they're still eligible for the high school rule. But our kids are just automatically eligible. Child welfare kids are automatically eligible if they're still in high school, even if they're beyond the age of 18. Or they can be enrolled in a college, a community college, or a vocational education program, a trade school. They can be employed at least 80 hours a month, or participating in a program or activity designed to remove barriers to employment. This is the key, I think this is the key eligibility criteria that we need to pay attention to, because youth could be simply volunteering, let's say volunteering at the hospital to gain hours of experience in order to enter into a program or a trade program, or to be able to, they couldn't get into community college, they had to wait their turn, so they're doing some volunteer hours while they're waiting to go to class, or they could only get into you know, a remedial class because they needed to take that before they could go on to college. Those are participating in programs or activity designed to remove barriers to employment. So it's pretty loose, the criteria is pretty loose, because what we want to do is really encourage youth to stay in foster care, stay in extended foster care, and get the help that they need to transition successfully. We want to improve our outcomes with youth who are exiting the foster care system. And if they stay within that safety net, their outcomes will most likely be more successful. So we have to, that's a big, that's another paradigm shift for us in child welfare in terms of making sure that we understand that there needs to be some flexibility in how we see them working towards those barriers so that they can be eligible. And then being unable to do one of the criteria, the other 4 criteria, because of a medical condition, and the medical condition does need to be a documented medical condition, but their inability to treat their medical condition, if they choose not to treat their medical condition, that's not a reason for them not to be eligible for extended foster care. They're still eligible because they do have the medical condition and it's documented. The non-minor dependents must sign a mutual agreement within 6 months of their 18th birthday, and they must reside in an eligible placement location and agree to work with the social worker or the probation officer to meet the goals of the transitional living plan. So they're still going to have a transitional living plan. They have to sign a mutual agreement saying they will, you know, continue to work with the social worker or the probation officer. They will still meet monthly with the probation officer or the social worker. They will still have a court case that they will either have a formal hearing or an informal hearing. Some counties may choose to do informal hearings to every 6 months for these youth to make sure that they're following their transitional plans. But those requirements are still in place in terms of seeing the kids, the youth every month, and the transitional living plan. So the bottom half of page 17 really reiterates what the values of AB12 are and gives some data that you can use to really support why extended foster care is so important. So this study was done, this is the Midwest study that was done. It was a longitudinal study that looked at kids, youth exiting foster care. And this is some of the data that they found, that 20% of these youth had felt totally unprepared for leaving foster care, and they were, they had no other option. 24% had been homeless at one time. Over half were unemployed. The median annual income was only $8,000 a year. 3/4 of the women had been pregnant at least once, and 42% had been pregnant 3 or more times. So as you can see, this is pretty devastating data, and what we want to be able to do is get our staff to understand the importance of why this legislation exists, that youth are not always ready to leave at 18 to transition out, and that it's our responsibility to make sure that they have the resources to be able to be successful, just like youth who are in our families. So you can use that data to really kind of bring home the point to your staff, and for social workers really to understand why this was important. I think for the if there are social workers who are listening to this, I think this is good information for you to use with caregivers. There are a lot of caregivers who may not be willing to, continue to care for youth beyond the age of 18, and this is really good data that you could present to them to say, these are the reasons this legislation exists, and these youth really do need our continued support. And the information is, I think, powerful enough that you could sway people to continue to provide care for young people. All right. Page 18 really talks about the values again, and we'll talk about that in a little more depth a little further through.
Sylvia, I just want to point out, just in terms of how this document is set up, that it's divided, so you can see we just got to the end of an activity. So those steps you were going through were things for the supervisor to say to the unit as part of this activity, and then these are just pictures of the slides, the accompanying slides for the PowerPoint that we'll just take a brief look at later. I just want to make sure people understand how we set this part of the document up.
Right. Okay. Most of the training materials are developed in this fashion too. So, all right. So page 19. Once again, I think this is additional information about the eligibility criteria for extended foster care. So it gives you, it gives you some additional examples that you can use. So it says be in high school or similar program. It talks about all the different kinds of programs, a GED, proficiency certificate, it can be a high school diploma. Any one of those will work towards a youth being eligible for extended foster care. So this particular activity really gives you just a little bit more detailed information for your staff or for yourself to know what are the kind of things that they can be doing. Work-study programs count, apprenticeships programs count. Once again, participate in a program or activity designed to remove barriers. They can be in a vocational rehab, an internship, volunteer activities. They can be participating in a substance abuse program to, resolve that issue. Anything that they're doing that really is working towards improving their life and making better choices so that they can transition into a successful adult. And all of that would be included in their transitional independent living plan. So this is an opportunity for you to just spend more time going over the details of the eligibility criteria. And the medical condition, once again, does have to be a documented medical condition. It can be a mental health condition or a physical health condition. The slide 11, these are all based on the slides, as Melissa said earlier. And the second part of the activity focuses on what the youth must do in order to maintain their eligibility for the extended foster care beyond the 5 criteria above, and that is they have to be willing to meet with their social worker or probation officer on a monthly basis. They have to continue that face-to-face contact once a month. They have to be willing to have either a court hearing or administrative review hearing every 6 months. Your individual counties will decide whether they do administrative review hearings or court hearings. They have to be willing to sign a mutual agreement that must occur within the first 6 months after they turn the age of 18. Now, them not signing the agreement does not mean they're not eligible. It just means that we need to maybe probably get them into court for a hearing to find out why they're not willing to sign the mutual agreement, because that's part of the participation criteria. They must have a transitional independent living plan that's updated every 6 months like we do now with the youth, that really focuses on what they're doing to move themselves forward to transition into adulthood. And they must be willing to work with the social worker and probation officer to meet those goals. So it's really a living, breathing, very dynamic document that continues to change and grow with the youth, and that's important. Okay, so slides 12 and 13 really talk about the types of placements that youth can be in while they're in extended foster care. So they can still be in a relative or NRFM home, a licensed foster family home, a foster family agency if they are willing to keep them, a small family home, THP foster care or THP plus up to age 9. Well, THP is up to age 19, and then there's THP plus foster care as well. Group home placements are allowed with exceptions, and that is they're very short term. So what we don't want to do is keep non-minor dependents in group home placements. What we want to do is work with them to transition into a different type of living environment. So if a youth is, turned 18 in September and they're in a group home, they can stay in that group home while we're working towards transitioning them out of the group home into another type of placement, maybe THP plus or something like that. Also, there are the new placement option is the supervised independent living setting, which the youth chooses. It can be an apartment, it can be a room and board arrangement, it can be a college dorm or a shared roommate arrangement. I think what's important for us to remember about supervised independent living settings is that the youth really gets to choose that placement. And this is another big paradigm shift for us because we're used to following the standards of community care licensing, and these facilities will have to meet the basic qualifications or the basic criteria that community care licensing requires, just like relative assessments do, but they don't necessarily have to be having their own room and having their own bed and having their own dresser, those kind of things. So if you think about college kids or just young people who decide that they're going to live with a bunch of roommates, and it's a 3-bedroom house, but there are 4 roommates, and so someone, your foster youth, ends up having to sleep on the couch. Well, as long as the as long as the facility is appropriate and has everything that it needs, and that youth is able to get where they need to go, get to school or to their work, wherever, from that facility, you can't tell them that they have to have a bedroom. I mean, that couch can be good enough for them. So we're going to have to be a little more flexible about the type of living, supervised independent living settings that we allow the youth to find for themselves. It's really our job to help them find appropriate placement, and if they find the placement that we don't, that is not appropriate, then we have a conversation with them about why it's not appropriate. But we can't not deny them eligibility for extended foster care because they don't pick a placement that we don't agree with. So that's really a big change for us. But those are the type of placements that are eligible. Remember, it's important to remember that foster youth are automatically in extended foster care unless they opt out. They can decide to exit at any time after the age of 18, but they can also come back anytime they want, as long as they're eligible or they meet the eligibility criteria. So if they want to come back and they say, I am going to go to school, I am registered, I just need a place, I need a place to stay, and I need to get back on my feet, then they can come back into extended foster care. Foster youth who decide to exit can re-enter anytime prior to turning 19 in 2012, or 20 in 2013, or 21 in 2014. All right. The slide 15 talks about KIN-GAP and the changes that have occurred in KIN-GAP. We talked about most of these earlier, but you can reiterate the same thing, that they now can be with a relative for 6 months. Prior to the guardianship must be ordered through the juvenile court. And it can be a ward of the court or a dependent of the court. It can be a probation child, or it can be a probation youth or a foster youth. Important also change is that KIN-GAP can now be used out of state, and that the benefits for KIN-GAP extend to age 21 for those youth who have a physical or mental disability. That criteria is regardless of what age they entered the guardianship at. So any youth that entered into a guardianship that has a physical or mental disability is eligible for KIN-GAP up to age 21.
Sylvia, we had a question. Sorry to interrupt you. Somebody's,
okay.
I think it's confusing sometimes talking about the benefits up to age 21. So the question is, was the extension to age 21 approved? People have heard that it's only for sure until age 20 and possibly until 21 if further approved by the legislature.
So my understanding is that the KIN-GAP and the AAP benefits are extended to 21, but the extension to foster care has not yet happened.
That's mine as well, yeah.
So if they're KIN-GAP, if they receive KIN-GAP or AAP, those benefits do go to age 21 now. The extension of foster care eligibility we won't know if that will be extended to age 21 until the year 2014. Did that answer the question?
I think so, yes, and I'm getting a thanks for the clarification message, so thank you.
Okay. All right, so the benefits for KIN-GAP do transfer out of state. I already talked about that. So let's talk about slide 17. Youth who are custodial parents, so our young youth who have children of their own, have the same rights to participate in extended foster care. They are also eligible for the supplemental foster care money, that the infant supplement that goes with the infant, that they get now when they're under the age of 18. Only that now it will go to the foster youth. So they still are eligible for that funding, for that infant supplement. But the fact that they have children does not mean that they cannot be part of extended foster care. There are some eligibility circumstances that do not allow youth to participate in foster care, and that is if they're married or in the military.
Or incarcerated.
Also, or incarcerated, that's right. I forget about those.
Yep.
Also, youth who participate in regional center services can continue to receive the dual agency and supplemental rates, and will most likely be transitioning, or what we will be doing as social workers and probation officers is transitioning these youth into adult facilities with the help of the regional center. But they still are eligible for the dual agency and supplemental rates.
Sylvia, I have a couple more questions for you.
Okay.
Is community care licensing on board with AB12 in terms of the lesser restriction on placements with respect to what you talked about in terms of sleeping on the couch, staying out late, especially in placements where there might be younger dependent minors? Would some kind of exemption be needed?
Community care licensing is on board with the changes of AB12, and they're in the process of developing the regulations for the youth beyond the age of 18 and the different facility types. There are going to be some, in terms of where you have foster homes where there are younger youth in the home. Those, if the youth stays in that home, if that youth was already living in that foster home and they stay in that home, the only change really is going to be the agreement that must be worked out between the social worker, the caregiver, and the youth about how the rules will be different for a youth who's now 18. So the answer is yes, CCL is on board with that, because what will have to happen is that social workers will have to work with the youth and the caregivers to make sure that there's an agreement about what the rules of the home are going to be. So even though a foster care provider may say, you can stay out till midnight, but they can say, I need you to be home by midnight because otherwise I'm not going to sleep all night if I don't know where you're at. Or you need to call me and let me know if you're not coming home just because I need to know that you're safe, those kind of things. So those are more the agreement between the care provider and the youth with, in conjunction with the social worker. But CCL is on board with those changes.
Lisa, were you saying something?
Oh, I was just going to say that all of the interim pieces for CCL are actually listed on their website, the new approval standards for each of the different homes. So they have got that posted, and I would totally agree with Sylvia. What will happen though is if the foster youth is in a foster home and they turn 18. Then the shared living agreement, that conversation that Sylvia talked about between the care provider and the youth and the social worker will occur. If they exit the foster home and then they would, say a couple of weeks or months later, they say, I really want to go back into that foster home, and there are other dependent children, then of course, we will want to try to do that, but they will be subject to an adult being in a foster home with dependent children and the regulations surrounding that. I don't know if that was helpful at all.
That makes sense to me.
So any youth that exits a foster home and then at some point wants to return to a foster home, if there are children in that foster home, they would need to have a background check completed on them prior to re-entering.
Right, if they were minor dependents in that foster home.
Right.
So we do have another question.
Daycare. Mm-hmm.
Okay.
One more question right now. You've talked a little bit about kin gap, but somebody is asking, are there other differences in eligibility for legal guardian youth? And so I'm not exactly sure what question that, I mean, exactly what the question is. I think there is the issue of the youth who are in a probate legal guardianship. So maybe you could talk about that.
Yes.
Which is they're not eligible, right?
Right. The probate guardianship youth are only eligible under the old high school rule, which still exists for them, which is if they're going to finish high school by the age of 19, then they're eligible for benefits just up until the time they turn 19 or finish high school. So they are not eligible for extended foster care.
Okay.
There is an eligibility curriculum that's being developed that has the very specific information about eligibility for the different groups, and I think that's going to be a curriculum that will really be much more helpful in that area.
And I think the other message that we're trying to get to people right now is just empowering the youth to advocate for themselves and to talk to, you know, the minor's attorney and obviously those people on the phone, the social workers and probation officers, so that we get 100% clarity as this rolls out.
Right. So those were slides 10 through 17, and that's another activity, activity number 3. So you see the slides on the screen are below those activities. So all that information is in those PowerPoint slides. I think, let me see, what is this? This information, this is the, okay.
This is just a Q&A segment for the supervisor to provide a time for the unit workers. And then go over the tracking tool.
Oh, okay. I think what's important about being able to have that conversation with your staff, if social workers, probation officers, caregivers, is really back to what Lisa said earlier, making sure that the youth feels that they have a say in what's going to happen to them and are able to make some decisions about what they're going to do to work towards becoming an independent and successful young adult. And that that paradigm shift for us is really that we're not telling them what to do, but really they're telling us what they want to do, and we're facilitating being able to help them do that. So it really is in a lot of ways more of a parental role versus, you know, a parental role in terms of really helping your youth transition into life and really helping them make good decisions and telling them what the resources are to do that and guiding them as opposed to telling them what they have to do. Okay, let's go to page 23. Page 23 and 24 and 25 are really, this is the AB12 fact sheet. This is a great sheet to give to your staff or even for yourself to carry with you, so that it's a quick and easy kind of Q&A that tells you what AB12 is. And so it would be something that I would give to my unit of social workers and say, this is something that you can hand out to caregivers, that you can hand out to the youth, that really talks about the legislation, what are the benefits, what are the values, you know, where youth can live, what the eligibility criteria is, and kind of in a nutshell. So really the fact sheet is just really a tool that you can use for whoever it is that you're working with, whether it's to give to the youth, let them read it. If it's the first time a social worker or probation officer is talking about extended foster care with a youth, they may want to leave this with them and say, you know, I'm going to get back with you in a week or 2 weeks and let me know what you think. Or leaving it with caregivers and saying, why don't you read through this so we can have a joint discussion with the youth about what we think, you know, what they think they want to do once they've read this information. So it's a good tool that you can use, and it's a really good way for your staff to really keep this information handy, because it's a lot of information to swallow.
So I have a couple more questions. I think we're getting a clarifying question about the legal guardianship question that was asked earlier. So it's a youth who is in a legal guardianship, but it's with dependency, and that youth turns 18 and meets the eligibility requirements otherwise and participation conditions. Is that youth who has an open dependency and is in a legal guardianship eligible for extended foster care?
They're eligible for extended foster care if the guardianship happened at the age of 16 or later.
Okay. I have another question for you.
Okay.
I have to scroll. And does it make a difference if that's with relative or non-related legal guardians?
Oh, that's a good question. I have to think about that one, you guys.
I think that somebody else had asked, and I replied privately, that our eligibility curriculum is in the final stages of being reviewed, and so we think it'll be available in mid-January. Yeah. So hopefully that will help.
And Melissa, if you want to just flag that question, and we can get a response to that.
We'll do that, yeah.
When we send it out. It gets very complicated very quickly.
It does. There are a lot of nuances to the guardianship stuff that doesn't make it just clear and easy. So I wouldn't want to give you information that may not be accurate.
What about kids whose court and CPS cases were closed in 2011, who will not be 19 until later in 2012? Can that child repetition the court to become eligible in 2012?
If they turn 18, if they're age 18 during 2012, they're eligible to re-enter. So even if they're, oh, that's a good, you know what? That's
because their case was closed.
Their case was closed.
Yeah.
So what I'm hearing about that question, because it's being raised a lot, is that something that the court will be able to weigh in on, and we're going back to the thing of the youth advocating for themselves, and that's one of the things that will need to be sorted out in a different venue.
Okay, so the youth could petition to re-enter, and then the judge would decide.
That is what I'm hearing.
Oh, okay.
But I haven't heard, I mean, I've heard that that is something that may happen, but I'm not sure of what the outcome of that will be.
Okay.
We're getting some responses from our participants regarding some of these questions, and I can share them. I'd like to share them because people took the time to type them in. I do want to note, though, that we have 20 minutes left today. So this person has said the state has given us the opinion, and I'd like to stress the word opinion, that if a guardianship was ordered before age 16 but did have dependency in place at age 18, which I think is really key, having that dependency in place at 18, it is eligible for extended foster care, but not eligible for other placement options. So the guardian would be the only placement option at that point. So I think that is going to, that's the flagged question that will follow up. So that's what one local jurisdiction has been told. And then it's true that ACL, regarding the youth whose case was closed but who's turning 18, the ACL does clearly say that there has to be an open dependency on January 1st, 2012. But I think, like Lisa and Sylvia were saying, some youth are planning to engage in some self-advocacy and petition. So we'll have to wait and see what happens with those cases. But the ACL is clear that there has to be an open dependency.
I agree with that, what you said. The ACL is very clear, but that we have heard other things around advocacy. And I think that the message that we're trying to get out is that, you know, just keep the engagement process going until some more things, you know, occur.
One more person is asking, is noting, I think, and asking about youth who've turned 18 already, but their dependency was not vacated or dismissed for whatever reason. And so what is the story with youth who are already 18 but still dependent?
They're eligible for AB12 January 1st.
That's my understanding as well.
Is open.
Is that what you, Sylvia, too?
Yes. Yes. That they're eligible.
Okay. Okay, well, I don't have any other questions right now, so we'll move ahead.
Okay, so I'm just going to really summarize this last piece because I want Lisa to be able to have her opportunity. The next couple of pages really, it's tools and tips for engaging with emerging adults, and it's a handout. This is really an opportunity for you as a supervisor or even as a social worker to read through this, to really understand the different developmental issues with youth at this age. And what's important for us, part of that paradigm shift, is how do we engage with these young people so that they can trust us and feel that we're a resource for them so that they can be successful in whatever it is that they want to do. And you can't do that without really understanding their physical development, their cognitive development, their psychosocial development. So in this age group, they're really experiencing things very differently than we as adults do. They think differently, they act differently, and it's important that we understand why they are the way they are. And this information that we've provided here really allows you to understand where these youth are coming from developmentally, and that's important. So it's really an opportunity for you to study this and gain an understanding of what youth experience during this transitional age time. Additionally, it covers some information about the different kinds of emerging adults. So understanding the 4 subgroups of emerging adults and how your youth will fit within these different categories or kind of vacillate between them. There's the accelerated adults, the struggling parents, the emerging adults, and the troubled and troubling adults. And it's important to have that information so that you can have a better sense of who those kids are, who those youth are on your caseload that fit within these areas of what are some of the things that they're struggling with, which may be able to help you understand them more. So it's really more of the developmental stuff that we need to know as social workers about this age group. I can't stress that enough, because I think that we're very familiar with working with, 0 to 18, but the 18 on to 21 is just a totally new age group for us. But developmentally, they have their own unique characteristics, and I think it's important that we as social workers don't try to treat them like 16 and 17-year-olds, but we also don't try to treat them like they're 24, 25, 26, and really understand the changes that they're going to go through developmentally, socially, psychosocially, and psychologically. So that is all good reading material, and those are all good tools. Those you have an identifying eligible youth handout that at the end of this training, here it is. Once again, it's a great handout for social workers to just have handy to remind them on a regular basis, or even supervisors when you're staffing cases with your social workers. Talking about a youth, is this youth eligible? Go through this handout and say, do they meet all these criteria, and are they eligible for this? At least until we get a better understanding. Not all of your youth on your caseload are going to be at the age of 18, and so it's going to take a while for us to really understand this information to where we don't need to look at some kind of handout to reference. I think you see that in how we're able to not always answer your questions, because we just don't have all the answers yet. So don't be afraid to use the tools that have been developed to be little cheat sheets for you to help you understand this stuff. I think that's good. Lisa, you want to, or Melissa, is there anything else? Oh, this is the tracking tool, yes.
Yeah, there's this little tracking tool. I think that's the only other thing.
And this is just a good tracking tool for individual social workers to use, or supervisors to use with their social workers, probation officers, to track the youth. Look at 2012, how many kids on your caseload are going to turn 18, when are they going to turn 18, and as you get youth who are older, adding them to this list, and just continuing to use this as a way of tracking the youth as they move towards their age 18. So this training actually offers a lot of different tools that you can use with staff, or social workers can use them on their own.
So I moved the screen. What you should be seeing now is the AB12 training resources. I was just going to go to the AB12 overview PowerPoint really briefly and let people see the PowerPoint slides that are available. Hopefully it will open. These are the slides that go along with that curriculum that we were just going through. So you can see it just provides the same information that we just went through, and is in support of this supervisor tool for use with your units. So I want to do a little check-in. We have 12 minutes left for this webinar, and I think we did want to get to the organizational assessment. So maybe just a very brief run-through of the organizational assessment, and then maybe there will be questions to take after that, and then we'll be done. Is that okay, Lisa and Sylvia? Do you guys agree?
Yes.
Sounds great.
Okay. So let me go to the
So while Melissa's pulling up whichever document she goes to, I just want to chip in and say that for this to occur, obviously the social worker, probation officers, and supervisors are the ones that are going to make it happen. And so I'm really glad that Sylvia was able to detail and give you a lot of information about how you can have that discussion either in unit meetings or in your individual supervision. you know, with your staff, or for staff to be able to take this and talk to caregivers and youth about it. And as Melissa said at the beginning, there are a lot of other tools that are available on the CalSWIC website, like the youth orientation for those of you that listened to that webinar last week, that you're able to take and use. The piece that I wanted to talk about just briefly is about, we understand that that the social workers and probation officers and attorneys have so much influence, but we also need to recognize that our organizations need to be ready to do this type of work. And for most organizations, there is going to need to be a culture shift to get us ready for that implementation. And so you do have a couple of tools that you can use to look at your readiness to implement AB12. And as we always say, implementation, it's not going to happen January 1st. It's a process. It's going to begin. It's been done for the last year, and now it's going to just continue. And we have had a lot of research around implementation and what makes implementation effective. And so if you go through the organizational assessment and you look at Part A, which is the information gathering, I would really encourage you to utilize these resources that Sylvia has also talked about, but as an agency level, looking at all of the legislation that's passed, all county letters, all county fiscal letters, the CCL regulations, and really looking at what else is out there that can help you, including your PQCR, your self-assessment, your system improvement plans. What is it that your county is doing for these youth? And I think that we also need to make sure that we look at our other partners in going forward. How can we partner with other, like higher education, mental health, substance abuse, CASA, all these other people and stakeholders that are involved. So the first thing that we encourage you to do is gather all of your information, and as we get further and further towards implementation, we can see a lot more information out there. The second part, which I'm sure you have all done by now, is the data collection. And as I hear counties throughout the state talk about implementation, a lot of counties are saying, well, it was difficult to get some of the ACLs out, and so now what we're really focusing on those individual workers and youth and supervisors, identifying who it is that's actually eligible come January 1st and who can re-enter, and identifying that. The ways you can do that is obviously business object queries. Contra Costa develops an AB12 estimator, and Safe Measures is also has developed a report to look at that. So really looking at those data pieces. The next very important part of any kind of initiative is looking at shared values and common language so that we all know what we're talking about. I know that one of the concerns for a lot of the youth, and Janae Swain, our partner from CYC, wanted to be here today, but she couldn't. But I know if she was here, she would talking about extension of foster care. What we don't want to happen is youth exiting our system at age 20 or possibly age 21 with the same outcomes that they are now. So how are we going to have our shared conversation and thoughts around what are our outcomes? How are we promoting permanency and lifelong connections and self-sufficiency? Another part that's very important for agencies is your staff training and engagement. How are you going to train your staff? How are you going to engage your stakeholders? What is it that needs to be rolled out? And I think that we're very, very fortunate in this initiative that CalSWIC has taken such a major lead with CDSS and other partners in developing training. And if you go to the CalSWIC website, you'll see a lot of resources there that can be used for different stakeholder groups.
Lisa, I just wanted to, Lisa, I'm sorry. I just wanted to show this list of the training that has been developed and is under development for AB12 that you had asked me to put in that document, but I wasn't sure which version of it you wanted,
No.
so I had it up so that I could show it when you got to this point. So just so people can see that of the completed training tools and curricula available include the AB12 overview, a youth orientation, training about partnering with emerging adults, which talks a lot about adolescent development and the development that happens between adolescence and adulthood. There's a great resources web page. And then these implementation materials that we've talked about. And then there's 2 more pages of curricula that are being developed and will be coming up on the website over the coming weeks and months. So anyway, sorry to interrupt you.
No, I'm glad. No, that's great, because I think that it is really important, because I know a lot of people are feeling a little bit of anxiety around getting those documents, and just to let people know that the curriculum that is posted on the CalSWEC website is vetted by CWDA and CalSWEC and CDSS and a lot of our partners and stakeholders and sponsors to make sure that it's accurate in the rollout. So I would encourage you to consistently go back to the CalSWEC website and see what other things have been posted. I think that this Part E of our organizational readiness assessment is probably the most important, other than our information and education of staff. It's really looking at our youth engagement. How are we engaging youth? And I know that when we started this process, people were like, no way, there's no way youth would ever stay in foster care longer. They want to get out as quickly as possible, and maybe that's true in some cases, but the opportunity for them to re-enter is available. And just how are we looking at our youth engagement? How are we getting the message out to our youth? So that's another thing for you as an agency to be looking at. So I just wanted to point out that there is that organizational readiness assessment. There is also an implementation guide, which covers a lot of what Sylvia talked about, but just from an agency level. And I would encourage you to go through that and come up with a plan for your county to work out how it is that you are going to implement, and then continue the implementation process for AB 12-212, and I believe the next one's 2012. And who is at the table, because we don't want to create another situation where it's child welfare and probation responsibility to do everything, but really partnering with all of those stakeholders that are so passionate about this issue, and how are we bringing them to the table. So that was mine in like 6 minutes.
That was very good.
Yeah, thank you, Lisa.
Thank you. I think yours was a lot more important.
So I am, this is the CalSWEC website, and this is our homepage. I'll send these links out to other people, to the participants at the end. It's calswec.berkeley.edu, and the AB12 training curricula are part of our in-service training and part of other training resources. The reason I'm sending you the link is because it does take a couple of clicks to get here. So sometimes people manage it easier with the link. But this is where you can get all of the trainings that we've been talking about, including the PowerPoint that I showed you a few minutes ago, and the implementation materials that Lisa talked about just a few minutes ago. So I don't have any additional questions right now. It is 2:58. We're scheduled to end at 3 o'clock.
So before we end, I just want to take this opportunity, Melissa, to thank you and CalSWEC for sponsoring these webinars, and all the amazing amount of work you've done with formatting and organizing everything. And it's been a real partnership, and you have been doing a lot of work. And I also want to thank Sylvia, who has an incredibly busy schedule and was gracious enough to talk today about this very important implementation plan, especially around supervisors and from the county perspective. So thank you, both of you. And we do have another webinar on Wednesday for trainers around the partnering with emerging adults. If anyone would like that information, Melissa can provide that to you.
I certainly can, and I want to say thank you to you too, Lisa, for really stewarding this process all along and helping us in California with the implementation of AB12.
Yes,
I think we have 12 days, so go
Yeah.
Thank you
okay,
both.
well, thank you very much, everyone.
Thank you. Bye-bye.
Okay, bye.